Welcome back to the show. Colorectal cancers are the fourth most diagnosed and the second deadliest forms of cancer in the United States. In this sponsored segment this morning, we welcome Dr. Scott Kitzy, surgical oncologist at the Karmanos Cancer Institute at McLaren Flint. He's talking about colorectal cancer and the importance of getting screened. Good morning.
Thank you for having me.
Yeah, thank you for coming in. Let's start out with who is most at risk for colorectal cancer?
Well, colorectal cancer affects somewhere from 1 in 22 to 1 in 25 Americans. So really everybody's at risk. But special populations include African American people, people who've had inflammatory bowel disease, and people with family members that have had colon cancer. And those are the people we focus in on. There's also an increase in the younger patients with colon cancer, and so that's kind of changed some of our management options for them too.
Yeah, that's been making headlines. It's affecting younger people, which is obviously a concern. So, with that said, who should get screened and when?
Well, anybody above the age of 45 should start screening, or 10 years younger than your earliest family member to have colon cancer. So if your father had it at the age of 50, you should be getting it at 40. And screening is a life-saving tool that helps a lot of people, and so really all Americans should be getting it.
Yeah, so again, take into account your family history. Screenings range from home tests to colonoscopies. Talk about eligibility for those and who should be doing those.
Yeah, colonoscopy is the gold standard for screening. It not only can find cancers early, but it can also treat early cancers or polyps, which can become cancers later on. And like I said, anybody above the age of 45 should be getting them, and it's really every 10 years that you should be going in for them. There are some home tests where basically you provide a fecal sample and they can test for either colon cancer or polyps. Those are for average age people, so people who don't have any family history, people who are kind of your standard person, and those you have to do every 3 years.
Gotcha. And then, again, it's not maybe the easiest topic to talk about, but I mean, what are some of those warning signs that people should be looking out for?
People with later stages will show up with blood in their stool. So that's a common thing that we find. Abdominal pain is not really specific to colon cancer, but can be an early sign of it. And bloating, abdominal bloating, not being able to eat or having normal bowel movements. And
then you talk about surgery as an option. When is surgery most likely to be a colon cancer treatment?
Surgery is very often a colon cancer treatment, and oftentimes it's the first treatment for colon cancer. We as surgical oncologists kind of have a knowledge of what should go first and what treatment should be happening in your process. But surgery is almost always a part of the colon cancer treatment, especially in the early stages.
And then finally here, how can people get in touch with you who may be watching today?
We're at the Karmanos Cancer Institute in Flint. We're right across the street from McLaren Hospital. You can call our office at the number on the screen there, and we're happy to see anybody with any diagnosis of cancer.
Yeah, then just bottom line, it's important to pay attention to what's going on in your body, right?
Exactly. Yeah. Exactly. Get care and get care early.
Thank you so much for your insight this morning.
Thank you for having me.
Yeah, we appreciate it.